And hello, everyone. Good afternoon, and thank you for joining us for our inaugural Research and Data Symposium. The future is now. I'm Mario Florio from NBC 10, the NBC television station affiliate in Rhode Island, and I will be your host today to facilitate what we expect will be certainly a fascinating discussion. We want to thank you to CVS Health for being a national and local sponsor of Go Red for Women, and to our local sponsor of this event, NTT Data. We will explore technology, research, and data and how it's impacting health behaviors and, more importantly, improving health outcomes. Our expert panel will discuss how artificial intelligence can really nudge people to make healthy choices, how large-scale data sets can help identify chronic disease and who is specifically at risk, and how healthcare delivered remotely is improving an individual's day-to-day behaviors and their overall health. So before I introduce our expert panel, I would like to welcome Vani Rajasagi to center stage to say a few words with us. Vani is a client executive with NTT Data, and a member of the American Heart Association Southern New England Board. So Vani, thank you so much for joining us.
Thank you, Mario. It's an honor to be here representing NTT Data and the American Heart Association Board here in Southern New England. On behalf of the entire board, I welcome you all and hope you enjoy the program. I've been fortunate in my career in that I've been able to combine two of my passions, which are healthcare and technology. Through data-fueled digital transformation, NTT Data helps clients provide human-centered, high quality, accessible, and affordable healthcare solutions and services. We also share the American Heart Association's vision of creating longer and healthier lives. We are proud to partner with American Heart Association to bring you this symposium today, and I can't wait to hear what our panelists have to say. Thank you and enjoy the session. Back to you, Mario.
All right, thank you, Vani, so much, and NTT Data for your support of this event. I would now like to introduce our expert panel. Please join me in welcoming, one at a time. We'll begin with Melissa Campbell, an industry consulting managing director with Health Insights lead with NTT Data. Melissa, thank you for joining us. Next, we have Sharon Vitti, President, Minute Clinic and Senior Vice President with CVS Health. And Sharon, thank you for joining us. We have Claire Kinsey, Vice President, Women and Kids Initiatives with the American Heart Association. Claire, good to see you. Thank you for joining us. And Pat Dunn, Center for Health Technology and Innovation with the American Heart Association. Thank you all for joining us. If we can make sure you all have your microphones unmuted as our conversation gets underway, that would be wonderful. Melissa, I'm going to start with you. How do artificial intelligence tools help providers navigate the complexities of chronic disease management?
Thanks, Mario. That's a great question. You know, we all understand that complex diseases often take a long time to diagnose. The road to that is often inaccurate and sometimes filled with trials and errors as far as treatment and medications. By leveraging a data-driven approach or artificial intelligence, you are able to shorten that journey. And by shortening that journey, you are able to improve quality of life, better manage costs, all those things that are important and that we work to do in healthcare every day. So artificial intelligence becomes really a tool in our tool belt to improve better care, drive better care. And the better your models are and the better your data sets are, the better impact that you can make.
Would you say that AI is the future of chronic disease healthcare?
I think it's a tool in the tool belt. I think what's important to keep in mind is that your models are only as good as how they were built and the clinical expertise that is partnered with it. You need that clinical expertise as you build the models, and you need that clinical expertise to train the models and then validate that the outcome is aligned with best practice, aligned with medical guidelines, et cetera. So I think it's a strong tool in our toolkit. I think it's a tool coupled with remote monitoring and clinical expertise.
Yeah, and I just want to, I forgot to mention at the top, we want this to be really conversational. Obviously, there's a lot of information out there. So if any of our panelists, our experts want to jump in or follow up what someone else has said, please feel free to. Sharon, let's go to you now. How does CVS Healthcare use consumer data analytics to enhance their customer experience?
So CVS has a lot of data, very robust data sets, and a talented analytics team. And I've learned a lot. I didn't have the background in retail. I'm a healthcare person, but the way they use data is really powerful. So I would say, the data we look at is allowing us to identify consumer patient preferences, their level of engagement and where they're engaging and how frequently, some health status indicators, their adherence to health activities, and then obviously the economics of what's going on. And so I would say in general, we use this data to personalize our engagement with consumers and patients. And what that could look like, that could look like something everyone's pretty familiar with, our front store and the targeted coupons and discounts that you get that are related to things that you typically buy. That could look like in our pharmacy, looking at the data and looking at where patients have fallen off on their medication regimens, and then being able to engage around adherence. We, on the Aetna side, looking at members, their engagement in healthcare, and then their gaps in care. And so one in particular, just to bring it to life, is the gaps in care program that we have. So we're able to pull together the claim data, the EHR data, et cetera, for members. And we're able to engage that patient by identifying where there's a gap in care, and then helping them get to that gap covered, engaging their care coordinator, engaging their PCP, engaging the pharmacist when the patient comes in and interacts with the pharmacist, or engaging the MinuteClinic provider. So when the patient may come into the MinuteClinic, engaging them around that gap in care. So really utilizing it to help patients improve their health and their awareness of where they have opportunities on the healthcare side.
Yeah, because a lot of folks, they have different providers and everything, but sometimes the common thread is the pharmacy that's they're going to for their medications and other services. So you can actually use a customer's data. You can see where there's a gap or something, and you can kind of help them out with that. Yeah,
that gaps in care, there's a lot of security and, certainly privacy issues that we work through, but that is a program, you said it quite well, Mario. The patients interact with their pharmacists more than they interact with many of their other healthcare providers. And so those interactions can be more meaningful if the pharmacist has information that they can educate and engage the patient on. And so one program would be a diabetic patient coming in. They're usually coming in for their insulin or their supplies, and they haven't had their A1C recently. And so the beauty is, one, educating the patient on why that's important. And then number two, certainly encouraging them to go to their primary care provider to get that done, or they can come to the MinuteClinic, which is typically right in the same store, if you will, and just making it easy for the patient to be able to answer or to take care of that gap in care.
How would you say CVS Health and the MinuteClinic has approached remote healthcare since the pandemic, which so many people have had to fall back on?
So, as everyone's lived through a lot. And when we look at the pandemic, there's clearly a lot of negatives, but I would say one of the positives that's come out of it is really the ability to look at virtual care as part of our healthcare ecosystem. And so MinuteClinic, I've got a kind of a long history with virtual care at MinuteClinic, but we've been focused on MinuteClinic since virtual care since 2014. And it wasn't until 2018 that we're able to stand up a national practice, despite a lot of skepticism around the viability of virtual care and providing virtual care. And so we stood that up. We had what was called a video visit. We have it across 49 states, including DC. Patients could receive care 24/7. And the real beauty of virtual care is to meet the patient where they are. They might be at home, they might be at work, they may be next to their child's crib, at 1 o'clock in the morning. And so that ability to provide that care was something we were really focused in on. And that particular program was a cash pay option with moving toward insurance. But at the time before the pandemic, we weren't there. Now with the pandemic, it's caused a lot of change. One, there's some relaxed regulations around virtual care for providers, which has has allowed more providers to take risk in this area. And then number two, we actually stood up a program in April of 2020. I remember it quite well because we were concerned that patients couldn't use their insurance for our current program. And so we stood up something very quick in like a record-breaking 6 weeks, and it's offered in all the MinuteClinic states, about 35, including Washington. We call it eClinic. But what that does is it allows the patients to connect with a MinuteClinic provider in their state, and that provider can evaluate, diagnose, treat common injuries, illnesses, skin conditions, and manage chronic conditions for established patients. And so that about 90% of what we do in MinuteClinic can be done virtually. And so for that year, for that pandemic year in that program, and from April through the end of the year, we conducted about 20,000 eClinic visits. And again, those folks were able to use their insurance, which was really the key differentiator. But so with that platform, and then with the behavior changes we're seeing with patients, this isn't a MinuteClinic phenomenon. This is happening across the country with both providers and patients adapting to this new way of receiving care. I think both providers and patients have been surprised at how engaging this can be. And so we have looked at, expanded that. We are using it for our behavioral health practice. About 60% of our visits with our licensed social workers in for behavioral health are done virtually. And then, I think we, anyone's kind of tracking this, our Aetna team launched a virtual primary care offering this year, that allows, kind of a new way of thinking of engaging people in primary care, because we know that's an important way to help patients stay healthy. So those are, and again, MinuteClinic has taken advantage of the opportunity to grow our virtual practice, but more importantly, the whole, both patients and providers have evolved. And so I think that's a little bit of a silver lining from the pandemic.
Great. And following up with all the great work that Sharon's been talking about with the remote work, Pat, I'm going to ask you to highlight with us what's being done in the space of remote cardio rehab and how we'll see an increase in quality care digitally.
Yeah, thank you for the question. So to really follow up on Sharon's work in remote healthcare, we've been working on remote home-based cardiac rehab that's supported by a technology platform. So there was already a trend towards home-based cardiac rehab following the American Heart Association scientific statement in 2019 that home-based cardiac rehab is as safe and as effective for most people, excuse me, and has the potential to solve the problem that currently only 20 to 25% of patients that are eligible for rehab, and you become eligible for rehab by having a heart attack or having a bypass or a stent. So only 20 to 25% of those patients were participating, even with the data that participants in rehab do significantly better. They have much better outcomes than those who don't go to rehab. Now enter COVID-19, which caused about 75% of rehab centers across the country to close. So that left patients in that critical time of need literally sitting at home. So there's even more urgency to find scalable, sustainable ways to deliver rehab remotely.
I'm going to touch on something both Sharon and Pat said that I think is really key, especially for those of us who spent our career in healthcare. This has really revolutionized three problems that we've been fighting in healthcare for what feels like forever: access to care, personalization, and the stigma attached to behavioral health. I mean, those, 30 years in this field, and I've been talking about those for 30 years. So, and I'm sure it's before then. So that's what we're seeing as part of the revolution, is truly attacking some of these core issues that we've been seeing in healthcare for a long time.
That's interesting, Melissa. You talk about the stigma that's associated with behavioral health. Do you feel like this digital platform is making it somewhat easier, more accessible for people to come forward?
Absolutely. I think from access to care, both from a stigma perspective and also just being able to get to your provider, right? I mean, transportation is one of the key challenges that various economic classes face in accessing care. So now it's there in their home when they need it. And, personalization, right message, right person, right time, right way. Those are the four tenets. And so this is achieving that. And that's exciting. That's exciting to see it happening finally and to be a part of that.
Yeah, I think across the country, when they look at the utilization of virtual care, there's some areas that certainly peaked up during the pandemic and then have gone down to a little more, not pre-pandemic levels, but certainly not as high as the peak of the pandemic. Behavioral health is stuck.
Yeah.
So we're seeing across the country, some of the highest utilization of virtual channels for behavioral health. And I know, just to add to Melissa's comment, one of the things around therapy and types of behavioral health interventions is the consistency of follow-up care, right? That is associated with the treatment plan. And so we are seeing the adherence to the treatment plan being higher for our behavioral health folks because I think of the options. You can do either, like you can do face-to-face care or you can do virtual care. And that hybrid model, I think, is really powerful. And so we're it's still early, but we're seeing some really good adherence for patients. And so one could assume that having options for care that is more convenient and more meeting the patient where they are may be adding to that increased adherence.
Yeah, just to add to that, we've always known how important the behavioral component to self-management is, whether it's rehab or heart failure or diabetes. And what we've been doing is just building those components. So whether it's stress and emotions, motivation, behavior change, all of those things are critical to the individual's success.
On that point too, we've seen it, we saw it when schools and children went remote during the pandemic, and we saw disparities in terms of different communities having access to the virtual learning and the digital tools. Is that something does that translate into the healthcare arena as well? And are you looking at ways to try to combat that and also help those communities that are at a disadvantage?
Absolutely. There's that I was gonna say, there's absolutely an access challenge, right? And there's some really creative solutions out there. I mean, there's organizations that provide cellular service and cellular phones and iPads. And so there's organizations out there, but I feel like these are great starts. I don't know if they've penetrated our ecosystem broadly and deep enough. And how do we find those that are having an access challenge when they're not accessing, right? So I think it's a continued challenge and a continued journey for us. I heard about an organization recently that there are mani-pedis in the home for diabetics that are also trained medical assistants. So they're going into the homes, they're laying their eyes on the patient, they're examining the foot care, they're laying their eyes on the ecosystem, all in the wrapped of we're going to do a pedicure in your home. I mean, solutions like that to me are amazing. And so I think that we need to, as an industry, continue to innovate in that space. So.
And who doesn't love a pedicure, right?
Right.
And I think if I pull Melissa's comments from the beginning together, and again, I think the virtual is one tool in the toolkit. It's not the panacea, but it's certainly removing barriers for some and creating access for others. Melissa's comments, I'm going to put two of them together. So one is around the AI. AI is a tool that can enable broader levels of providers to practice at the top of their license and to provide care in different types of settings. And so that MA that's going into the home, and MA is, a lower level provider, but if they have tools that allow them to bring in cognitive information from, the AI tools or from higher level providers, they can expand the level of care that they're able to provide. So I think the AI, especially as it's coupled with virtual, is the future and can really help support different types of providers at different levels to broaden the care that they're delivering.
Yeah, and Melissa, you mentioned personalization and AI. We strongly believe that there's a role for technology, but it's not just the technology, it's the messaging that's going through those pipes. So it's really building and supporting the health literacy and frankly, the confidence of the individual to actually act on the information. So it's one thing to just be able to send the information, but it's also even more important that they understand it and they can act on it.
And you want your models to have that feedback loop so they get better and stronger, right? So knowing that you sent a message, it was received, it was accessed and acted on, that's a data point that needs to go back into your model because
It's
it tells
two-way.
you something. Exactly.
The clinicians need support as much as the patients do. It can't
Yeah.
just be a one-way communication flow.
Exactly.
When we talk about the health inequities, Pat, great point. The ability to use the harness the data and the personalize how we're treating or how we're communicating with patients is really important. And I think, language barriers are a perfect example. And if we're able to utilize some of these tools to make sure that our providers have culturally based language communications and clinical presentations. And again, we all know that, but it just hasn't been that easy to bring it to bear for every patient encounter. And so some of these tools will allow that, which again, I think that's a combination of personalization and also trying to remove some of those barriers around health equities.
But you hit on a point. Oh, go ahead. Sorry.
No, just in our system, we call that human-enabled AI. So it's not just pure AI, but it's really supporting the clinicians and really helping, like you say, to work at the top of their license to really be more effective in their communication.
And I think there's a subtopic to that, Sharon, too, is your model is only as good as the data that you put in it, right? I think all of us learned early in our career, garbage in, garbage out. But if we need to use very broad and comprehensive data sets to train these models, because if they don't include socioeconomic classes or races or genders or education levels or things like that, these models are only as good as the data we give them. So you've got to really be skilled in providing as much data and as diverse data as possible, or you run the risk of perpetuating challenges that you're trying to solve. So I think that's a huge piece that I want to hear when I talk to organizations out there that are like, we have an AI tool that's going to solve the universe. So let's roll it back and let's learn really what went into it, because I think that's a risk that could happen with the wrong or not large enough data sets.
Just want to remind folks who are taking part that if anyone has any questions for any of our panelists, that we will be taking questions over the chat at the end of the program, and we'll pass those along. So please feel free to do that. Claire, we want to bring you into the conversation. Let's talk a little bit about Research Goes Red and why it's so important.
Sure, thanks. Happy to be here, and happy to kind of talk a little bit about how we're leveraging technology and data for women's health specifically, as well as the context of removing barriers, which has been discussed today and is so important. So, I'd almost like to start by asking everybody to kind of take a step back and imagine, you're sick, you're going to a care provider for treatment or being prescribed medications, or you've been diagnosed on symptoms that haven't been extensively studied, researched, or tested on someone like you. And unfortunately, that's the reality still facing a lot of women today. Our healthcare and the treatment we receive still has largely been studied in males. And that's also true for subjects used in animal models, which always is still surprising to me when I read that. So, you might be asking, how is this possible? It's 2021. And the historical context, which I'm sure many on this call know, is that, around the mid 70s, women of childbearing years were largely excluded in participating in phase 1 clinical trials. And the conventional wisdom at the time was that it'd be easier, safer, more cost-effective to just do the same studies in men, because how different are men and women really? Turns out quite a bit. And we're still learning that each and every day. But even after an act of Congress with the NIH Revitalization Act to mandate the inclusion of women and diverse audiences, diverse populations into clinical trials, we have a lot of catching up to do. And as of about a year ago, women still only make up about 38% of cardiovascular clinical trial participants, and women of color even significantly less. And even in biomedical research, again, upwards of 80% of research animals are males still. So even though it's been 30 years, we know women are not little men, but the truth is women are paying the price from being understudied, underdiagnosed, and undertreated. And so if anything we learned in the last 18 months, as technology continues to expand and data literally pouring in, we now have the capabilities to come together really and leverage science, technology, data, and diverse populations of people to develop solutions faster than ever before. And they say, necessity is the mother of invention. And so about 2 years ago in 2019, we launched an initiative called Research Goes Red, and it's in collaboration with Verily's Project Baseline. And really, our vision was to create an initiative that could put women in the driver's seat to accelerate scientific discovery by creating bold goals. We like bold goals at the Heart Association, but to create the world's largest, most engaged women's health registry and research platform. It was also an opportunity for us to connect women and as consumers to researchers and scientists with technology in the center. And so again, it's a collaboration with Verily's Project Baseline and also our Institute for Precision Cardiovascular Medicine. So we leverage our precision medicine platform to really help drive a lot of the data analysis in conjunction with Verily, which is a Google company. So we're kind of combining the power of all three. And when we launched it, it really was an opportunity for us to help change the narrative in women around who can and should participate in research. For many people that we talk to, they don't even know where to go to participate in research, and they're not sick. So we have a lot of women who think that I'm not sick, I'm not being prescribed a drug, I don't need to contribute data or participate in research, and we know that's just not true. We really need to understand how disease progresses in healthy and well populations as well as in unwell, so that we can better identify, understand, and develop therapies to treat it, and even more importantly, prevent it. So really, when we look at the platform, once women consent into it, they have the opportunity to participate in surveys, contribute their data. And I would imagine everybody here probably feels the same. Getting somebody to actually give you their email address these days seems to almost take an act of Congress, because who needs another newsletter? But we really were able to tap into kind of that narrative and that vein of women and the understanding that they weren't being treated based on the unique aspects of a woman. And so we really were able initially to engage so many women to consent into this initiative and start contributing to surveys. Start contributing to studies. And one of the best ways to describe kind of the model is that when we launched, we have an evergreen kind of longitudinal survey open that asks women to tell us what are their greatest health concerns. And out of the initial cohort that responded, we had thousands of women respond within the first few months of it. Their number one health concern was access to care and cost of medications. Number two was weight. And so based on the demographics of that particular cohort, we launched last year one of our first two funded studies, that is a deep phenotyping study looking at weight changes during the menopausal transition. And so it's currently engaging and recruiting women. We're almost done with recruitment in it, but it is looking at those different factors and aspects, everything from first measure physical traits, waist size, body fat level, inflammatory markers, hormone regulators of appetite, different things that women are doing throughout the day in that pre, peri, and post-menopausal change, because menopause is a huge transition for women. And I was just reading the other day, I think by 2025, it's estimated globally, there'll be 1.1 billion women that are just through the menopausal transition. So it's a huge group of women, and it's a very important issue. So really what we're looking to do with that study is translate that science to actionable solutions to help women better manage weight changes during that transition, understand the mechanisms, but then return that information, not just to publish in science, but really use that to get it back to the community for actionable solutions. And so in this, we've got another funded study in right now that really is looking at how do we engage millennial women of underrepresented groups into research, because that is one of our biggest gaps. And we also know that most of us, we live by this. So if we're not here, we are missing the opportunity to capture so many. And the way Research Goes Red really was designed was to break down geographic barriers for participating. So in the example for the weight study, everything is done remote. So you do not have to go into a research center. We send Bluetooth scales. You're able to go to kind of a local lab, contribute or do some diagnostic testing there, and it's all sent electronically to the research center and the PIs, and you don't really have to go anywhere. So whereas traditionally before, geography kind of excluded the opportunities to participate in research, this is an opportunity for us to continue to break down those barriers. So, and we're just getting started. And again, we're leveraging cloud computing through our precision medicine platform. The data gets transferred over on a very regular basis, and we have workstations. So really the goal is to have this just a treasure trove of data across a variety of different variables in women, so that we can really start understanding different aspects of not just cardiovascular disease, but disease in general and how it's manifesting in women.
So Claire, you feel like you've made strides in reaching more women and reaching the population you're trying to get to?
I think that we are just starting to scratch the surface. We have a long way to go. We have a long way to go in reaching our most at-risk populations. There's a lot of kind of historical, cultural context for us to overcome and reaching younger populations and diverse populations. There's a lot of trust involved. One of the reasons I think we have been successful in that is that there's an incredible amount of trust within the AHA name and brand. But we're reaching more, but we've got a lot of work to do. So what we really want to do is create, ultimately get up to 1 million women that mirror the US demographics, and really have 1 million women that have raised their hands and said, put me in, I'm ready to play, I'm ready to get involved, I'm ready to contribute my data, I'm ready to be a part of the solution. And it's so far, the results are really exciting. We've got a few additional surveys and engagement opportunities that ask women about their experiences and perceptions in accessing the healthcare system. How do you feel that your gender has impacted the level of care that you've received or are receiving? Do you feel like you're waiting longer? Do you feel like your symptoms are getting dismissed? Also, the other side of that is reproductive health. So we're really kind of, again, shifting our focus into the way women live every day, ages, stages, and seasons. And not 18 to 24 and 25 to 34, which is how we've looked at kind of cohorts of women before in the past, but really looking at what's going on with women now and how do we help them today with really the issues, the problems that they're waking up in the morning worrying about. And what's so beautiful about the technology and the ability to link so many data sets up globally is allowing us to do that faster than ever, so that we will get to the problem of today, and not in 3 years.
And Pat, if you can speak also to what the AHA is doing around intelligent health solutions and how that's being supported.
Yeah, so our intelligent health solutions are a series of care plans and content assets around cardiovascular conditions such as heart failure, cardiac rehab, stroke, even high blood pressure, diabetes, and high cholesterol. And we built a content management system that has over 3,000 content assets. So ranging from videos and articles and messages to assessments. And what we're doing is they're designed to be delivered to third-party tech platforms. And so it's not direct to consumers. What we're trying to do is help the tech world get the science right. So the way it works then is we have about 40 tech platforms in our network. And what they can do then is they can, through an API, they can actually build these care plans and content pathways directly into their platforms. So we can then deliver it directly to their customers, basically. So it's a new system. We're actually announcing our new system at our scientific sessions meeting, which is in less than 2 weeks. So we're really excited about it.
That's great, exciting stuff. Melissa, can you kind of talk about how you feel NTT Data is using technology to encourage, people to adopt healthy behaviors?
Absolutely. So at NTT Data, who I work with is provider groups, life sciences companies, health plans, et cetera. And so what we want to do is enable them to support their stakeholders, their members, their consumers in driving healthy behaviors. And part of that is having technology ecosystems that can do all the things we're talking about on this call, right? Create, collect the data, provide access to content, provide artificial intelligence models. And so really making sure that we understand the current technologies, their value, their place, and how they're used is something that we do with the health outcomes in mind. And what's interesting is when I started my career, we had the triple aim, right? Lower costs, increased quality, and increased experience. And so now we call it the quadruple aim, because there was something we were forgetting, was provider experience. And if you're fixing something in one box and breaking it in another, that's not a win. And so how do we address workflows that not only make it very easily accessible for the people who need the care, but also make it easy to administer and deliver that care? Incorporating, Internet of Things, right? Let's think about all the remote monitoring tools that are out there. It's really amazing. And you're seeing that in some of these non-traditional entries into the healthcare space, right? Best Buy is there in the health space. So how do you, as a healthcare company who's committed to this quadruple aim, that's committed to the health of your members or consumers or patients, how do you leverage the latest technologies to drive the outcomes that you are truly wanting to drive? And so that's what we do. And we try to bring not only our current industry experience, but expertise from across the industries. I think that's something that healthcare is starting to realize, is there are industries that are ahead of us in innovation and ahead of us in personalization and ahead of us. And we need to be learning from them. The retail industry, the financial services industry, CPG, what are they doing to understand behaviors and then drive the behaviors in the direction that we want them to go? My joke is the analytics and tools that you use to figure out how to make someone buy Coke over Pepsi is very similar to the analytics that you use to make other behavior changes, right? So if the behavior change is getting your eye exam when you're a diabetic, right? We need to use a similar approach, different variables, of course, different messaging, but we need to be learning from the other industries, as well as just focusing on how do we be best in class within our industry. And so I think those are things that kind of we work on every day, and staying understanding of what's out there, right? Understanding how we connect our ecosystem, our organizations that we work with, to these things, and that they have an understanding and an ability to operationalize those to drive the impact that we're trying to do.
So the goal is to use these tools to try to figure out, identify people who are at risk, who are they, and how do you get them to the services and care that they need.
And that personalization message is just, that's just something that is such a core to kind of my belief system around healthcare, right? So CVS is an example that I use all the time, right? With their specific coupons and things like that, because we've got to be dealing with people in a way that they respond to it. And historically, we've not done that. We've kind of had one way to talk and one way to deliver the message. And oh, well, some people just don't pick their healthcare, and we've really got to reframe that. So, and technology is the key to that, whether it be to enabling access, like we were talking about, providing advanced analytic models, remote monitoring. Technology is the key to that forward progression, all of those paths. So that's what's exciting.
I would agree. We've learned a lot from the retail and consumer product industries on how to deliver messaging, and that it's not a one size fits all. There's some people that are very proactive. They want a lot of information. There's other people that are less engaged, and you just have to have a different approach. So it's part of our system. We've built different pathways based on that person.
Yeah. And the ability, Melissa, you mentioned that there's the patient and then there's the provider. And, Pat, you talked a little bit about some of the pieces that you're going to make easy for a provider to get to in regards to clinical guidelines, et cetera. And so there's a lot of data out there for the providers. How do you take it and synthesize it in a way that is useful to that provider and allows them to elevate their engagement with the patient and their clinical expertise?
Actionable, right? My go-to phrase is, so what? You showed me a bunch of pretty charts. That's awesome. It's interesting, but so what, right? It's knowing what data is needed to drive actionable output, because we know that our healthcare ecosystem right now, resources are stretched beyond any limit they've ever experienced. And they need the help that they need has got to also be personalized and delivered it to them in a way that they can receive it and act on it and still continue to deliver care. So that actionable piece is something we need to stay laser focused on when we're using these tools or these analytics to make them generate value for the providers as well as the members.
Is the approach similar when you're trying to reach members as opposed to providers? Or do you approach it differently?
I think there's some similar constructs, right? It's just like the choice, it's behavior. So I think that there are providers that are far more technology enabled than other ones, right? So how do you get the same message at the same, or similar messages at the same speed in a way that they can respond and act on it? So there's absolutely some similarities in the personalization, in my opinion. I'd be interested in hearing the other panels, but there's some similarities. The variables might be different, but the approach I think is very similar.
Yeah, we really think for both patients and consumers and professionals, it's really important, especially in today's world, to be science-based.
Yes.
So on the professional side, making sure that they get quick access, not only to the guideline, but also the evidence that supports that guideline so that they can trust the information. And some patients actually have a desire to get that same information. Others couldn't be bothered. So again, that's where the personalization comes in. But for everybody, to the extent that they trust the information, they're much more likely to act on it.
That's a great point.
Sharon, what would you say other institutions, companies can learn from the new approaches you were talking about that your organization is doing?
Well, I think we talked a lot about the data. So I'll go back to the multi-channel approach for providing care. And I started with virtual care. I can tell it's one of my areas, but we've learned a lot in doing this. So the first thing is around virtual care, and virtual care takes on many forms. It could be video visits, it could be asynchronous care, it could be asynchronous, just sort of texting, it could be telephonic. It could be remote monitoring and pulling data together that then is actionable. So I think that's a really important part of our future in creating options for patients. I mean, in the home would be the other avenue, right? So face-to-face, virtual, and then in the home. And, we've actually learned a lot. One, fingers crossed that the relaxation of some of the federal state guidelines and payer reimbursement rules stay relaxed so that it will enable this to continue. But I would say, we have learned a lot around both patients and providers getting comfortable with different channels of care. Other countries do this. We are slower in adopting this, but I think on the provider side, some of the things that were, our NPs and PAs, our nurse practitioners and physicians assistants have actually gotten over that hurdle of finding out that it's not that different than providing care, face-to-face care. There's ways to really get comfortable with the format of a virtual visit. And I think multiple providers across the country have done that, not necessarily by choice, but and then giving them the tools to be able to do that. And I think we've talked a little bit about that, whether it be, making data clear to them, evidence-based guidelines of sort of the, how they should be practicing around a particular disease presentation. And I think that on the provider side, the other thing we've learned is not every patient is comfortable in every interaction or every health presentation is appropriate for a virtual interaction. And so that combination, we call it the hybrid model of virtual and of in-person care is really important. So, and actually home care. So, and the providers are sometimes, the care team, sometimes the best to determine that in collaboration with a patient, understanding what their needs are. And then I would say on the patient side, I don't know, I think patients are going to really expect virtual care to be a part or an option in their care model. And so it's kind of, it used to be a differentiator. Now I think going forward, it will be table stakes for care providers. And I would say easy technology is really important. Like we all, and maybe you all are experts, I still struggle, even though I've done probably, 10,000 WebExes and Zooms, but making sure the technology is really easy. And again, that's meeting the patients where they are. That could be the hurdle for them to really be comfortable in this kind of care setting. And then I do think, as I said before, I do think that the virtual may lead to increased compliance with a treatment plan and or follow-up care, removing some of those hurdles. The one other thing I would say is the care has to be integrated. Like you can't just have virtual care and then you have face-to-face care and then you have home care and then you have remote monitoring. Like it all needs to be tied together. Mm-hmm. The EHR can typically do that. And there's obviously other things that would do that, but that consistency of providing care using evidence-based guidelines, using the same tools in these different formats is very important. And so I feel overall, removing those hurdles, making it affordable is key to engaging patients in their health and improving the health of our communities and the overall cost of care. And I do think the virtual health channel in conjunction with face-to-face and home is really our future.
I was just going to say that we're calling this the future is now. So
True.
I just want to get kind of a sense, a general sense from each of you within the work that you're doing and the issues you're trying to address. Where do you say we are, and where do you see things going? Melissa, we'll start with you.
Sure. I think, one of the things we hear about a lot is the Amazon experience, right? This is the bar that people are setting for all of their experiences and all their virtual experiences. So I think that we need to that intuitive, easy access, like what Sharon was saying, right? We've got to continue to focus on that. I think we've got to continue to focus on blended models. It's never going to be all virtual. It shouldn't be all virtual, right? That should be a tool. I think it's continue to look at a robust tool set, continue to make sure that the data we're using is being used ethically, that it's unbiased, that it's diverse, and learn from other industries. I think it's to continue the things that we're trying to do now and make sure that we don't lose traction. I think COVID was the silver lining of COVID is what it's done to this virtual and remote access to healthcare. And it catapulted us, right? It moved us faster than we've moved previously. But I don't want to lose that, right? That's what I keep thinking about every day is how do we continue that level of momentum so that we meet the members and the patients and consumers where they are. So I think it's keep up the work, keep up the pace, and listen. We need to listen. We need to listen to our peers, our competitors, other industries, the patients, the doctors, the professionals. We have to listen. And so I think those are the things that I want to focus on as we get to bringing more technology to solve these problems.
Claire, your thoughts?
Yeah, no, I mean, it's hard to follow that because I echo a lot of those. I think, especially from what we've talked about today, it's got, and this has been mentioned too, but just to reiterate, it has to be easy to do. It has to be easy to understand. It has to be connected, and it has to be relevant. And so, especially from a consumer patient standpoint, they need to be able to get it and get it fast. The clinician, the provider, it all needs to be connected together, and it's only going to get faster. So I think having these conversations now and really looking at, okay, how do we connect it? It's not, de-silo it. So it's not something that's just done in different channels, but how do we actually connect it and build on it? And then ultimately really get it back to the end user, the consumer, get it into their hands in a way that they can actually apply it to their daily life. And live better, live healthier, live longer. I mean, that's the ultimate goal. And so there's a tremendous opportunity with the tools that we have today, but even thinking about the tools that we have tomorrow. If you think about where we were 10 years ago, just think about where we're going to be in 5. And so we've got to get ahead of it and do it now and really look at how do we do that in that responsible, ethical way, but in a way that ultimately achieves our goal of helping people live longer, healthier lives.
And Pat?
Yeah, I would echo that. I mean, honestly, COVID has forced the issue. It's really forced us into a more of a virtual world. A lot of times it was, oh, my patients would never do that. Or even now, I can't wait to get back to the good old days when we can do everything face-to-face. The reality is face-to-face is great in some cases, but the reality is that's only for the people who had access to face-to-face. There's a lot of people in rural areas and frankly, even in urban areas that just don't have access. And this is an incredible opportunity. That being said, the technology needs to get better and even, the hardware and the software so that it can be more relevant to people. But I think the future is very bright in this area.
Great. And Sharon?
Yeah, I think we're in a tremendous place right now. There are so many new technologies and personalized services and organizations out there popping up, different care models to meet patients where they are and to to tackle some of the big issues in healthcare. I feel like it's a little fragmented. And so really the work is to utilize the data to really hone in, to focus, to prioritize, and make sure we're thinking about things that are relevant. And then the other is to use the technology to connect the dots, because it is still, it's good to have lots of options and all these great, new services and new programs, but like it's still overwhelming to the patient. And so how do we connect, make the path easy for the patient, relevant and prioritize, and then how do we connect the disparate pieces using the technology, especially the providers and the different caregivers across the ecosystem. So I think we've got a lot, and I mean, this is one of the most exciting times in healthcare, and we've got a great opportunity here to really move to the next level. And I think patients are ready. I think a little bit about what Pat was saying, like patients are accepting this now, and so we have to take it to the next level, and I think we will, but it's going to take a little bit.
Yeah, you want to make sure it's not a lost opportunity, I think.
Yes.
Right? Exactly. I don't know if any questions from for anyone participating that has registered for this. I don't see anything on the chat, but I think it's been great. Anyone else, anything that anyone wanted to say that didn't get a chance to say that you want to say?
I think we mentioned a little bit. I think the other piece is not only, just focusing on the general population and the needs, and I think we're doing a good job of identifying where the disparities are. They've always been there, but they're more at the top of the surface now. And so utilizing some of these tools to chip away, because it's something that we as a country have known, but I'm not sure we've made great progress. We've certainly made some progress, and Claire's comments around, the progression of women's health and the research is just one component of a multidimensional set of inequities. And so I think we as a country can focus here. We can do both, and we need to. And I think, again, taking advantage of the opportunity to make a dent and to really remove some of those barriers is really important.
Great. All right. Well, Alicia, thank you all for being here. Thank everyone who logged on and registered to part in this, but most of all, of course, our expert panelists for all your insight, all your great information, and a look at where things are going. And I think everyone has a very hopeful sense of where healthcare in this country and this industry is going in the future. So Melissa Campbell, Industry Consulting Managing Director with Health Insights Lead with NTT Data. Thank you so much.
Thanks, Mario.
Sharon Biddy, President, Minute Clinic and Senior Vice President with CVS Health. Thank you so much. Claire Kinsey, Vice President, Women and Kids Initiative with the American Heart Association. Thank you. And Pat Dunn, Center for Health Technology and Innovation with the American Heart Association. Thank you all so much. And everyone have a great afternoon.
Thank you.
Thank you.